We are getting a first look this morning at just how many Canadians are getting sick with COVID-19 on the job. A CBC News investigation is revealing tens of thousands of compensation claims have been filed over COVID-19 across the country. But not all of them are going through, even claims from frontline healthcare workers. Inayat Singh is with us this morning. He's with our CBC News investigative unit. He's in Toronto. Let's begin with these numbers. I said tens of thousands. These are pretty, jaw-dropping numbers. What does your investigation reveal?
So we wanted to get an idea of how many people are getting COVID-19 at work. And we found the best way to do this is to get the number of workplace compensation claims. These are claims filed by workers after they get injured at work, including infectious diseases like COVID-19. What we found is over 26,000 claims related to COVID-19 have been submitted to these provincial compensation boards across the country. And just over 20,000 claims have been allowed. That's when the boards decided that the worker did, in fact, get COVID-19 at work. The remaining claims have either been turned down or are still pending or have been withdrawn. Now, this doesn't tell us the whole picture because this only counts those workers who file these claims. It doesn't count those who can't or did not file these claims. But we still found that this was the best way to get a nationwide picture because outside of this, it's kind of a patchwork of tracking that's not really comparable.
So, Inayat, there on the screen is again the number, more than 26,000 claims. But as you said, a significant proportion are being rejected, even from frontline workers. What's happening in those cases to lead to their being rejected?
So we spoke with a community legal worker here in Toronto who works in this system and helps workers file these claims. Here's what he had to say about the numbers and those not getting their claims approved.
Is a lot of acknowledgement that we're getting sick in the workplace. But that also begs the question of what is happening in the cases where people are not getting approved. Ontario breaks down their numbers, and you can see that huge sections of the working population in really high-risk areas, like various healthcare sectors, are having their COVID claims turned down.
Now, we did speak with a worker who did have their claim approved. Jeffrey Friedman is a COVID long hauler. He got sick in April and still has lingering health effects from the illness and the hospitalization. He was in the hospital for 44 days, just over a month of that on a ventilator. Here's him describing his symptoms.
Now I'm just starting to able to put my hands out because of pain in my shoulders and everything.
Like he cannot lift his
my left arm, I've lost half my strength. I can't squeeze. I can never be able to drive again. There's a lot of issues.
So Jeffrey's case really shows the importance of these claims. His claim is replacing part of his lost wages, but also doing other things like helping him retrofit his washroom at home so he can use it with his injuries. But yeah, there are hundreds of claims that are not being approved. For example, in Ontario, about 300 claims from workers in nursing and residential care facilities have been disallowed. These are obviously frontline workers. And then on top of that, there are also a lot of workers who are not covered by the workplace compensation system at all. Here in Ontario, about a quarter of workers are not in the system. So we have these challenges with accessing coverage, with then proving that you got COVID at work. And all of these are sort of issues that we need to look at as people return to work during the pandemic.
Inayat, thank you very much for bringing this forward this morning. Inayat Singh is part of our investigative team at CBC News.